Japan is facing its worst flu outbreak in 25 years, with over 300,000 cases reported in December 2024. Hospitals are overwhelmed, medications are scarce, and travelers are at risk. In this video, we'll break down what's happening and how to protect yourself. Stay informed. This crisis affects us all. The flu season started early and hit hard, with cases doubling weekly. Experts blame reduced immunity after years of COVID-19 restrictions and a surge in holiday travel. Influenza A and B strains are both circulating, making this outbreak unlike anything Japan has seen since 1999. Post-pandemic immunity debt is a key factor. Masking during COVID-19 limited flu exposure, leaving populations vulnerable. Now, relaxed restrictions and crowded gatherings have created a perfect storm. Hospitals report 64 patients per clinic, double last year's peak. This isn't just a flu season, it's a public health emergency. Antiviral drugs like Tamiflu are in critically short supply. Pharmacies across Tokyo and Osaka display out-of-stock signs, leaving patients untreated. Pharmaceutical companies are ramping up production, but shortages could last weeks. Without medication, severe cases risk hospitalization, or worse. Taiwanese actress Barbie Hsu's death shocked Asia. She contracted the flu while vacationing in Hokkaido, developing fatal pneumonia. Her tragic case highlights how quickly the virus can turn deadly, especially for those with asthma or heart conditions. Even young, healthy individuals aren't safe. Japan's healthcare system is buckling under pressure. Emergency rooms are turning away non-critical patients, and wait times exceed 6 hours. Doctors warn that this is just the beginning. With flu season peaking in February, the worst may yet come. Stay tuned for prevention tips later in this video. Travelers beware. Airports like Haneda and Narita are hotspots. Tourists report difficulty finding clinics, and travel insurance claims for flu treatment have spiked by 300%. If visiting Japan, pack masks, sanitizer, and contact your doctor about prophylactic antivirals. Safety first. Flu vaccines are your best defense, but demand outstrips supply. Japan's government prioritized high-risk groups, leaving many unprotected. If you're eligible, get vaccinated now. For others, strict hygiene and avoiding crowds are critical. We'll share expert-approved prevention strategies shortly. Symptoms to watch include high fever, chills, muscle aches, and respiratory distress. Unlike colds, flu hits suddenly. If you feel unwell, isolate immediately and seek testing. Early Tamiflu use within 48 hours cuts severity by 70%. Don't wait, this virus moves fast. Why is this outbreak so severe? Blame H3N2 and H1N1 influenza A strains, known for rapid spread and mutation. These variants evade immunity from past infections or vaccines. Combined with holiday superspreader events, Japan's perfect storm became inevitable. Schools across 15 prefectures have closed. Kids are high-risk carriers, and outbreaks in classrooms are rampant. Parents scramble for childcare, while educators fear lost learning time. A Tokyo teacher says it's like COVID all over again. The societal toll keeps growing. Economic impact is staggering. Workforce absenteeism costs Japan $2 billion weekly. Retail and hospitality sectors suffer as shoppers stay home. With GDP already shaky, this flu could tip the economy into recession. Recovery depends on curbing infections quickly. Barbie Hsu's family urges flu awareness. Her brother shared she was healthy. It happened so fast. Her death trended on Weibo, prompting millions to seek vaccines. Celebrities campaigned for prevention using Flu Alert, turning her legacy into a global call for health and action by spreading awareness, not virus. Pneumonia danger is real. Flu weakens lungs, allowing bacterial infections. Hsu's autopsy confirmed streptococcal pneumonia. At-risk groups include seniors, smokers, and chronic illness patients. If you develop chest pain or trouble breathing, seek ER care immediately. Delays can be deadly. Mask up. Japan reinstated mask mandates on trains and in hospitals. While not legally enforced, compliance remains high. N95 masks reduce infection risk by 80% in crowded spaces. Pair with hand washing, 20 seconds with soap to stay safe. Small steps save lives. Travel insurance is crucial. Ensure your policy covers flu treatment abroad. Clinics charge $300 or more per visit, and medications cost extra. Carry a translated medical history and no embassy contacts. Better safe than stranded. Plan ahead if visiting Japan this winter. Home remedies help, but aren't cures. Hydrate, rest, and use fever reducers like acetaminophen. Avoid aspirin in kids due to Reyes syndrome risk. Elderly individuals might try humidifiers and electrolyte drinks. Remember, antivirals are essential for high-risk groups. Don't rely on tea alone. Japan's government response includes free vaccines for seniors, emergency funding for hospitals, and public service ads. Critics say it's too little, too late. We needed action in October, argues Dr. Kenji Osaka. Lessons for future outbreaks include preparing early, stockpiling meds, and educating relentlessly. Flu and COVID share similar symptoms but pose different threats. COVID still circulates, but flu is now deadlier in Japan. Testing clinics offer dual swabs. Get checked to confirm. Remember, flu's incubation period is 1 to 4 days. COVID's is 2 to 14. Speed matters for treatment. Workplace outbreaks are worsening. Offices in Shinjuku report 30% staff absences. Remote work is encouraged, but many jobs require in-person labor. Employers distribute masks and sanitizer, but gaps remain. Union leaders demand paid sick leave. No one should work while contagious. Children under 5 account for 25% of cases. Pediatric hospitals are at capacity, with IV shortages reported. A Kyoto nurse says they're reusing beds. Parents, watch for dehydration and lethargy. Seek care fast. Flu kills over 100 kids annually in Japan. Global implications are growing. Neighboring countries screen travelers from Japan. South Korea and Taiwan tightened airport thermal scans. Could this become a regional crisis? WHO monitors closely but hasn't declared a pandemic. Still, vigilance is key. Viruses don't respect borders. Mental health challenges are rising. Isolation and fear resurge as anxiety grows. A Tokyo resident shares that they're terrified to leave home. Hotlines report spikes in calls. Communities rally with grocery deliveries for the sick, but psychological scars may outlast the outbreak. Future waves loom. Influenza B typically peaks in February and March. Experts warn of a double epidemic if A and B collide. Cases could surpass 5 million by spring. Preparation is urgent. Stockpile essentials and avoid non-essential travel. The worst may lie ahead. Vaccine myths persist, but they're simply not true. The shot doesn't give you the flu. It's an inactivated virus. Natural immunity is risky and unreliable, and even fit people die. Trust science, not rumors. Vaccines save lives, full stop. Japan's outbreak may foreshadow global trends. Climate change and urbanization help viruses spread. Researchers urge investments in pandemic preparedness, emphasizing the need for proactive measures. This growing concern has been echoed by WHO's Dr. Maria Van Kerkhove, a wake-up call for nations to strengthen their health systems. Personal stories humanize the statistics. A Kyoto nurse works 18-hour shifts. A father loses his son to flu due to the outbreak. A traveler is stranded without meds. These voices remind us of the human cost. Share your story below. We're listening. Together, we can fight this. To stay safe, get vaccinated, wear a mask in crowded places, and act quickly if you feel sick. If you're planning to visit Japan, avoid traveling unless you're vaccinated. Support healthcare workers on the front lines and stay informed. This outbreak evolves daily. Knowledge isn't just power, it's survival. Flu isn't just a cold, it's a killer thriving in Japan's post-COVID chaos. Spread awareness of the situation by protecting yourself and others. Wear masks if you're feeling unwell. Small actions like covering coughs create collective safety. We're all in this together. Stay vigilant and act responsibly. Thanks for watching. If you learned something, smash that like button, subscribe, and ring the bell. Share this video to spread awareness. It saves lives. Comment your questions or experiences. Stay safe, and we'll see you in the next update. Together, we beat this.